drive them there, and they have to have somebody drive them home, and they're kind of woo-wee, but they have a little recollection. You're telling me no recollection at all?
None.
They're out?
They're
now,
out.
what does that, other than obviously comfort and convenience, you said that the patients actually heal better sometimes?
Yes.
That you're able to do more? What, from your point of view, having the patient out and comfortable, what does that allow you to do?
Well, first of all, I believe it's more safe than giving somebody a pill. And second of all, although all the parameters are the same, you still need to have somebody drive you and come here. Your post-operative or after the fact discomfort's much less. Your healing time is reduced because we can give you medications through the IV that actually are anti-inflammatory, are very helpful in the healing process.
So with the IV, you can actually start the healing process before
Absolutely.
you've started the hurting process.
Yes. Yes, that's correct.
Does it allow you to take what may have been a 3, 4, or 5 visit treatment and compress it into one?
Condense it into one, that's correct also. Yes.
Is there a reason that you chose? Because obviously, you know, I know that it's a little bit more expensive, a little bit more risky. Is there, why would you choose to offer that to your patients? Is it purely because you do implants, or is it just?
No, well, I think that anxiety and the fears that people experience in the dental industry have pretty much destroyed this industry. And I think that whatever I can do to make...
Why is that? Seriously, why is everybody so paranoid of going to the dentist?
Because it hurts. And plus, I mean, can you think of another thing in your life that's as psychologically demanding as right here? As your facial features, your mouth. I mean, everything starts and ends right there.
Right, and I don't really like people sticking their fingers in my mouth.
Exactly. So whatever I can do to make someone more comfortable, decrease their anxiety level, decrease the time it takes for them to heal, decrease the amount of pills they have to take after the fact so for pain or different things. That's what I'm about. That's what I want to do. That's what I like.
No, I'm going to change the subject on you here a little bit, and it probably has nothing to do with what I wanted to talk to you about, but I just found it interesting. You're fluent in Japanese.
Well, per se, yes.
Well, you've spent time in Japan. I've observed you speaking Japanese with patients. Obviously, this market has a large. Did you learn Japanese because of the large Japanese population here, or because you speak
French?
French?
I speak fluent French. Yes.
And is it from world travels? Did you just? I mean, you spend 500 hours a month or a year going to school to learn what you do, and now you're taking languages. How many do you speak?
That's funny, but I speak some Spanish. I took that when I was in high school. But I like to travel, and when I graduated from high school, I lived in Europe for 3 years. I spent 3 years in France, and I learned French from doing that. And when I came back and went to college, I had a minor in French, and so I learned French that way.
Do the patients like it? I mean, here's what I equate it to. I'm going to the dentist. I'm nervous anyway. If I went to the dentist in some country that I didn't speak the language very well, and the dentist was able to speak to me in English, that might alleviate some.
Yes.
So did you learn Japanese because of the?
Well, I lived in Japan off and on over the past 15 years. I've spent a lot of time there. I like the Orient. And there are 20,000 Japanese people in Las Vegas. And I advertise in Japanese magazines. I have Japanese patients that fly here from Japan to have me treat them. And I just find it fun. It's exhilarating that I can talk to other people in their own language and help them and get a smile out of them from their own language. I find it makes them very comfortable.
And it makes them relax.
Absolutely.
All right, come on, show me something.
I got tired of seeing my short, stubby little yellow teeth in the front. I'm a past smoker. I smoked for probably 40 years, and then I decided that I needed to clean up before I retired. So I wanted to get my teeth put in order, and I went and visited Dr. Perkins' office. And the professionalism right from the beginning was wonderful. I felt comfortable because that is a big undertaking to have your entire mouth being redone. Dr. Perkins and I had discussed it, and we decided to go with numerous implants on the right side. Altogether, I have 6 implants, and I have the whole top of my mouth is veneered. I was shown exactly what was going to be done, and then I think I was a little fearful, wondering if it was going to hurt. But I have to say, I never went through any pain. It was never easier than what I've experienced here, and I've been to numerous dentists in the past. The staff is always ready when you're scheduled appointment. Oh, this has made me feel wonderful about my life. The confidence, Seeing myself, I'm no longer hide from pictures because my teeth are now just beautiful. They're so natural looking, and it's just given me all the confidence to go ahead in life.
Well, it was an accident. I was in this big convention, and then one of the two teeth fell off, and I have to get it repaired. And so I look at the phone book, and nobody wants to work with me. I'm diabetic, and he said, well, there's nothing I can do for you on implants because I'm diabetic. And Dr. Perkins said, as long as you can maintain your sugar level, then I'll be able to work with you. Well, it was a challenge for Dr. Perkins because I had my dentures for a while, and he said the bones were already not available, so I have to have some grafting. And he had bone grafting. I got some teeth left at the back, and then I got some teeth left in the front, but my front here and most of here, they're all done by Dr. Perkins. He knows what he's doing. He knows what to expect. He tells me what to do and what not to do, so I'll be prepared, and I'll take good care of my implants. It's not only for vanity, of course. Every woman wants to have a beautiful smile, but for me, it's more of eating the food I want, whether they're hard or not hard, tasting the food I want. Now, even my own friends and my husband, they really love my smile.
That's just incredible, Doc. You know, every time you show me something, it just reminds me of how different your office is than most. Now, let's talk a little bit about technology. What a part it plays in your practice, how important it is to dentistry in general, and basically what's changed and how quick it's changing. Like, tell me what's going on right here.
Like, for example, this is our sapphire laser whitening system. It reduces the amount of time it takes for somebody to whiten their teeth. It reduces the sensitivity following that.
Now, because that is a big thing. A lot of people have the take-home trays. A lot of people, you know, I talk to people that have seen the whitening strips in the stores, and
that's correct.
There's no control there. Basically, one size fits all. And,
that's right.
And somebody told me by the time you get done buying enough to whiten your teeth, you would have been better to come in and do this. But
I agree with that.
Everybody tells me that the in-chair whitening in the dental offices causes your teeth to be really sensitive. Cold hurts, hot hurts after that for a few days.
It can, yeah.
Yeah, is that something that this helps cut down on?
This helps cut down on a lot. Of all the systems out there, this is absolutely the best one.
Now, is this a pretty new addition to your office?
Yes. Basically, it's a major investment for the office as far as comparatively speaking for other systems, but I feel like it's a better investment for this office as far as
obviously
keeping people,
following your protocol, it's a little safer.
Right, exactly.
So tell me a little bit about more technology.
We were speaking of IV sedation earlier, and you can see over here we've got our hospital quality monitoring system. If you were to go into a hospital or an operating room or an emergency room, you'd see something just like that. Although that's not required for my office, we have it here because for us it's a way of keeping our patients more safe.
Do the patients like knowing that you're maintaining that?
Yes, I think so.
All right, now I want you to show me, you talked to me about a machine that you have that eliminates or cuts down, reduces, whatever you want to call it, the risk of secondary injury, because like if you have to cut bone, which you obviously do sometimes because you put in implants, up until recently, and it's probably still in most offices in the country, the everything's cut with either a scalpel, a burr. They're in there with something. You have something now.
Like what you're saying is a dental drill, and traditionally, if you were to talk about cutting into or doing implants, you know, one little slip of the finger could mean major repercussions. Stitching things up. Well, this is one of our, speaking of technology, it's one of our little instruments that we have in the office.
Now, you make a point about being a little instrument in the office. I about fell out of my chair when I found out how much it cost, but you got to be driving a car.
Right,
but what does it do?
Well, this will actually cut into bone, but it will not damage soft tissue like your skin or a nerve. Or your gum tissue, for that matter.
So if you would do surgery with a scalpel, a burr on a drill, twitch, bump, patient moves, there's that risk of a secondary